And this is all really fancy, but how scalable is this approach for smaller centers without significant computational infrastructure?
Right. That gets back to sort of the implementation of all of this. And, we're not in the consortium, we're actually the smallest center. The other centers are larger, right? And we've had these conversations on the calls and whatnot about you know, how do these smaller institutions or these small places really integrate this sort of technology. And again, I think it's going to, there's not a one size fits all. And I think, the more and more people like Mary Pasquinelli and others integrate this at institutions, will understand better how this can be scaled to other um, places.
What has been the biggest scientific and operational challenge in coordinating across institutions like UIC, Mass General, MIT, and others? We talked a little bit about, the potential for stops in electronic health records, but what else did you come across?
Yeah, I mean, I think whenever you have a consortium, whether it be in this setting with an AI tool or whether it be in a biorepository sort of setting with a collection of samples or just sharing data in general between sites, it can be a large, that's a big ask for all entities, right? How do you protect PHI? How do you, ensure that the data is all collected the same way so that it's can all be used and analyzed together. The great thing about the consortium is that there were lots of talks about how we were going to collect the data and what we should be collecting and making sure that there's sort of a standardized approach to how we're collecting data. And of course, going through the process of data use agreements and all of that, that those are all things that have to be in place for a consortium like this to operate, which we have. So there are a lot of there are a lot of things that have to be considered when you're thinking about putting together a large consortium like this.
Where does the consortium see Sybil's role over the next 3 to 5 years in clinical trials versus real world screening?
The hope is, I think, that with some of the funding that we have, we're going to be doing these prospective studies to kind of show that, number one, it's validated in populations, right? In a heterogeneous population. And number two, it can be used sort of in hopefully to screen outside of the screening guidelines. Hopefully to, down the road be integrated into practice to help, again, improve detection of lung cancer. My hope is that in 3 to 5 years, we might have some interesting biomarkers that we've discovered that, kind of correspond with Sybil scores that we might be able to start thinking about as sort of a preventative strategy, a medical preventative strategy.